Welcome to the MasterMed Indications for PTCE 2026 video. This video provides pharmacy technician exam prep, focusing on certification strategy and knowledge pearls. To tackle the PTCE 2026 exam, avoid common traps like confusing indication versus mechanism, and be sure to identify all active agents in OTC combo ingredients. Also, master biologic suffixes to understand drug classes. Use a multi-step reasoning strategy to match patient scenarios with appropriate first-line therapy based on clinical guidelines. Key cardiovascular indications include hypertension, treated with ACE inhibitors, ARBs, and CCBs, and heart failure, managed with ACE inhibitors, beta blockers, and loop diuretics. For post-MI, dual antiplatelet therapy is standard. Memorize the class suffixes for quick identification. For type 2 diabetes, metformin is first line. Insulin therapy is divided into rapid-acting and long-acting. GLP-1 agonists offer dual benefits. For hypothyroidism, levothyroxine is the synthetic T4 hormone, critically taken on an empty stomach. In psych, neuro, and pain, SSRIs are first line for depression, while SNRIs treat neuropathy. Triptans are for acute migraine, but are contraindicated in coronary artery disease. Opioids like morphine and tramadol are scheduled for pain management. Memorize DEA class versus indication to avoid trap questions. Common antibiotics include amoxicillin for otitis media and sinusitis, doxycycline for atypical pneumonia, and TMP-SMX for UTIs. Inhalers are split into rescue, albuterol, and controller, fluticasone. Biologics often end in MAB and require TB screening before use. Watch out for combination products like loratadine/pseudoephedrine for allergy relief. For OTC considerations, omeprazole is for frequent heartburn. A trap is misoprostol, which does not exist, OTC. Single ingredient questions often list combo products as wrong answers. Key supplements include vitamin D for bone health and melatonin for sleep disorders. St. John's wort, used for mild depression, is a critical exam topic. It reduces the efficacy of oral contraceptives by inducing the CYP3A4 enzyme. LASA, or look-alike sound-alike drugs, pose a risk. Note the differences between hydroxyzine, an antihistamine, and hydralazine, an antihypertensive. Use tall-man letters to signal different indications and prevent harm. High alert classes include insulin, anticoagulants, chemotherapy agents, and IV digoxin. Critical exam tips involve knowing narrow window scenarios and double-checking dose and indication match. Errors here are flagged as critical. Here's a sample question. For a newly diagnosed 55-year-old with HTN and no comorbidities, which is first line? The correct answer is A, losartan, and ARB, which along with ACE is first line per JNC8. Avoid picking C, clonidine, which is second line. In this sample question, a patient asks for a medication with only pseudoephedrine. The correct answer is C, Sudafed. Claritin D contains both loratadine and pseudoephedrine, making it the wrong choice. For a GLP-1 agonist for weight and T2DM, select the correct suffix. The correct answer is B, -tide, as in liraglutide. Master suffixes like flozin, gliptin, and sun for quick identification. A patient with CAD wants an acute migraine medication, which is contraindicated. The correct answer is A, sumatriptan. Triptans cause vasoconstriction, which can exacerbate CAD. Naproxen, acetaminophen, and propranolol are generally safe alternatives. Which pair uses tallman to distinguish an antihistamine from an antihypertensive? The correct answer is A, hydroxyzine versus hydralazine. Tallman lettering is crucial for preventing errors in similar drug names. What is the indication and warning for St. John's wort? The correct answer is B. Depression reduces OCP efficacy. St. John's wort is a CYP3A4 inducer, which speeds up the metabolism of oral contraceptives. Prednisone 40 milligrams daily is ordered. What is the primary indication? The correct answer is D, all above. High-dose corticosteroids like prednisone cover a broad range of severe inflammatory conditions, including Addison crisis, rheumatoid flare, and status asthmaticus. For a 28-year-old pregnant patient with a UTI, what is the safe option? The correct answer is B, nitrofurantoin. It is a Category B drug, safe after the first trimester. TMP-SMX, doxycycline, and ciprofloxacin are generally contraindicated. To maximize time and points, Manage your 110 minutes for 90 questions. Use a scratch sheet to jot down drug classes. Always choose an answer. There is no penalty for guessing. Use the 3-step elimination strategy. Deconstruct the stem, identifying indication keywords. Filter by class mismatch. Finally, select the best answer using guideline first-line evidence. Thank you for watching this video on Master Med Indications for PTCE 2026. We hope these strategies and knowledge pearls help you succeed in your certification.